Hello there, everybody. It's Dr. Steve with Kinesi, and this is your Start Your Healing Now, what to do and where to start. So today we're going to talk about stenosis, spinal stenosis, and particularly in the lumbar spine. What that refers to is a narrowing of the opening where nerves are exiting the side of the spine. These yellow things are the nerves. So that would be a foraminal stenosis. The foramina is where the nerve is exiting the spine, and that can sometimes be narrowed down, and that's called stenosis. Or the stenosis within the spinal column, that would be called central canal stenosis. So either of those can be going on, and that's a pretty normal, natural kind of thing that will happen to a lot of people in life. Now, it's certainly not a death sentence, but one of the big things that if you're over 50 and you have pain that starts when you're standing or walking, but then you get relief from sitting, that's a really good indicator that, yeah, stenosis might be part of what's going on. So one of the troubles with stenosis is that the extension, bending back, tends to close down those spaces and cause some of the pain. And so we want to make sure that if you have stenosis in one region, that everything above it and everything below it is moving really well. And so rotation is going to be the theme we're going to use today. And we're going to make sure that at the hip, where it's a ball and socket joint, we're getting lots of rotation. And then in the thoracic spine, where the joints are designed to be able to rotate really nicely, we want to make sure that we're getting a bunch of rotation there, because both of those things are going to help improve the extension that stenosis struggles with. So we are going to start with the first thing here, which is going to be some arm swings. So using a wall or using a post, something like this, one hand is going to just be stable on whatever it is, something solid in front of you. And the other hand, we're going to start with these rotation reaches. So you're reaching out and back and across, really letting the whole body kind of play along and open up. So if standing at the wall, the one hand in front, and you're reaching under and reaching back, and just really kind of opening everything up, letting your chest and your upper back move. So, of course, we'll do both sides here. And you can take this in a direction of doing a little bit more extension, mobility focused if we do a little bit of a down and a little bit of an up. So we're reaching a little down and then reaching a little up as you rotate back will give you just a bit more of the extension mobility. So you don't have to do it down and up all the time, but doing a couple of versions, having the hand stay level, and then also a little bit of a lower and higher reach will be great. Okay, and then we're going to do the bottom half, and so this is going to be where hands are connected to something like a wall, and one foot is going to step back, turning the toes out. So what's happening here is your shoulders are stabilized because they are hanging on to something, and we are rotating the pelvis and the hips from below. So we're going back and forth here. Doing both sides. You can hang on to something like a post, and that also works well for doing the step back, turning the toes out, and creating that pelvic rotation. Doing both sides. And that's going to be a great starting point for getting your body moving when stenosis is the deal and you're struggling with that. So we want to improve the mobility through the hips. We want to improve the mobility through the thoracic spine. That's going to make life better for the low back, the lumbar spine that's stuck in between those two. And where we have a lot of difficulty with extension, When we're coming back because of stenosis, we're using rotation to be able to help open that up. So that was part 1. Be sure to tune in for part 2 and then part 3 eventually as we keep working on your stenosis. Start your healing now, what to do and where to start. Okay, until then, keep moving everybody.